storm coming to Florida has health officials worrying that standing water could contribute to the spread of Zika virus. So we have the director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, with us now. And, so I've read a few stories about this, but first of all, is that true? And explain to us how it would work, how that would actually lead to the spread of the Zika virus.
Well, whenever you have standing water, it makes it very easy for mosquitoes to breed. One of the ways that you can shut down a Zika outbreak is by mosquito control, and that has to be a very aggressive way of getting rid of mosquitoes, preventing them from breeding and get rid of their breeding places and killing the adults as well as the larvae. That becomes much more difficult when you have standing water around that's difficult to control. When I say standing water, I mean water that could be in pots, pans, tires, even something as small as a bottle cap. And when you have rain and storms, it just counters against the efforts of health authorities about trying to clean up the environment. So that's one of the things you worry about, since mosquito control is the most important tool that we have in fighting the Zika outbreak.
So when we look at Florida and in Palm Beach and Miami-Dade counties, I believe the number of cases is in the 40s, 43 for Zika. I believe that's correct. So
right.
What type of concern are we talking about if they are hit with, this tropical storm is serious and the water standing around? And a lot of, could those cases go up by a lot? I mean, what types of things could happen?
Yeah. Well, it's very difficult to predict. Certainly, we don't want it to become sustained and disseminated. The very aggressive activities on the part of the Florida health officials, together in collaboration with the CDC, have done a good job of keeping those numbers of cases relatively low. You'd like to see no cases, but the amounts they've seen is relatively low. Certainly, you could have an outbreak of a considerably greater size. Hopefully, that won't happen. I don't think it will, but when you're trying to control it by vector control, what you don't like to see is something that would get in the way of your adequate vector control, and the weather can sometimes be your worst enemy because of the continuation of providing standing water.
Speaking of which, I mean, the weather, just the story of the weather itself is probably a far more dangerous and story to the general population. Not to diminish people who are suffering from the Zika virus. Obviously, it's serious. But as you say, the numbers are so low that in a state as large as Florida, the odds of something happening to you because of the weather that they're expecting there is probably far larger than coming down with the Zika virus, right?
Well, that's true, but you have to remember, Zika as a disease, if you exclude pregnant women, is a relatively mild disease. 80% of the people don't even know they're infected because they don't have any symptoms. The other 20% have relatively mild symptoms that are really self-resolving. In about 7 to 10 days, they go away. This becomes a real issue when you're dealing with pregnant women.
Right.
Because what would otherwise be a mild disease, if you get infected during pregnancy, you have the possibility of having a very serious birth defect and congenital abnormality in your child.
That's why you want those numbers to be at 0 or as close to it as we possibly can. Dr. Fauci, thank you very much.
You want those numbers to be 0.
Yep, very good perspective on all of this. We appreciate you coming on with us.